Hi, everyone. Welcome. My name is Marianne Mertz. I'm a nurse care coordinator for ALS United Greater New York. And it's my honor today to welcome Dr. AJ Sampat, who's going to speak to us about his ALS journey, thoughts, reflections, and unsolicited advice for healthcare providers and fellow patients. Dr. Sampat is an associate clinical professor of neurology and sleep medicine at the University of California, Davis. He completed his medical school at the University of Chicago, Pritzker School of Medicine, followed by a neurology residency at Northwestern Memorial, where he served as chief resident. Dr. Sampat completed a sleep medicine fellowship at UCLA prior to joining the faculty at UC Davis. He has won numerous teaching awards throughout his career, and he has found clinical teaching, advising, and mentorship as the most cherished roles of his professional life. Today, he comes to chat about a more personal topic, his journey over the last 2 years living as a patient with ALS. Welcome, Dr. Sampat.
Thank you, Marianne, for that very kind introduction. Let me go ahead and share my screen here. Great. So hopefully everyone can see this okay. Let me see if I can hopefully go away on its own. So as Marianne mentioned, my name is Ajay Sampat. I'm an associate clinical professor of neurology at UC Davis, but I have this unfortunate and truly ironic distinction of being a person who is also living with ALS. And so I'm coming here today to share with you my ALS journey. This was a talk that I originally gave with our neurology residents at UC Davis. And so initially the talk was titled Thoughts, Reflections, Unsolicited Advice for Future Neurologists. But since that initial talk, I've given a variation of this talk over 60 times at various institutions with various different audiences. And I think, it's probably relevant for anybody in healthcare. Any healthcare provider who's on the call here, any nurse, any therapist, and really even caregivers. Caregivers and patients alike. My fellow patients, I think, can hopefully benefit from hearing some of these things. So, like I said, this is a little bit of a unique talk for me because I'm usually used to giving this talk to medical audiences, to fellow doctors. But I do think there's elements here that I think my fellow patients can relate to. And I think it'll be helpful for everyone. So hopefully it's impactful. All right. So the first topic I want to go over is this concept of sympathy versus empathy. And this is, I have three or four big themes I want to share with all of you. And these are all themes that I have learned as a patient, being on the other side of the table, the exam table, so to speak. And the first big theme that I learned is this distinction of sympathy versus empathy. So to illustrate this difference, I want to share with you examples that I had in my real life examples in my diagnostic workup. So I had all my workup done locally here in Northern California, but I recognize that I have a luxury and privilege that most patients don't have with this condition. And that's the fact that I'm a physician, and not just a physician, but also a neurologist. And so I had sent my workup to various experts around the country to get their input on my diagnosis, clinical trials, management, etc. And I had sent my workup to this neurologist who I'm going to call Neurologist A. Neurologist A is a well-known leader in the ALS world. Senior faculty member, director of a clinic, etc., etc. And I sent my workup to Neurologist A, and mind you, I'm early on in my diagnostic workup here, so I am feeling all the emotions that you all probably felt when you were going through this journey yourself. Anger, shock, sadness, scared, frustration, everything. I'm going through all these emotions on my own. And I'm waiting on the Zoom call for Neurologist A to come on the call. And Neurologist A comes on the call and he looks at me and he says to me, after pausing, he says, Dr. Sampat, I have looked at your workup. Thank you for sending it. Do you think you've got it? And of course, I am truly taken aback by this response. I said, you know, I don't know if I have ALS, sir, but I'm hoping I don't, of course. I'm here to get your opinion. And he says to me again, he says, you know, Dr. Sumpet, I have looked at your workup. I'm sorry, but you have ALS. You have this condition. And I tell you verbatim that's how the first 30 seconds of that call went. The first 30 seconds of my interaction with this neurologist. I had an hour call with him and I got a very useful discussion, but I had a wall that was put up between me and him after those first 30 seconds. It really changed the entire demeanor, the dynamic of the discussion. And I thought this neurologist, you know, of course, didn't have the best bedside manner, but I also thought he exhibited a prime example of sympathy. Sympathy. This feeling that he was sorry about my trouble, my grief, and my misfortune. I truly felt the pity. You know, he was sorry about what I was going through, but I felt a distance between me and him. I didn't felt heard or cared for or validated in that discussion with this neurologist. And I share this with all of you because I know many people have probably had very similar experiences with their own, interaction with the medical establishment. And if you've had that, know that you're not alone. Even I, a professional in this field, had the same experience. And it's really, really discouraging and really upsetting. Put this on hold because a week later, I had another call with a different neurologist. Same setup, workup done locally here in California. I sent it to this person. She's on the East Coast, well-known person in the ALS world, senior faculty member, et cetera, et cetera. And I come on the Zoom call, with the same set of emotions that I'm going through: worried, anxious, nervous, angry, scared, etc. And neurologist B, I'm going to call her neurologist B, she jumps on the call and she pauses after looking at me and she says to me, Ajay, thank you for sending your workup. I've looked it over. Before we get into that, just tell me how you're doing. How are you feeling? I can only imagine this is a very overwhelming experience for you and your family. It didn't take a lot of time. It took about 20 seconds for her to say those words. But for me as a patient, I truly, truly felt that she was trying to understand my experience. I thought she exhibited a prime example of what I feel like is empathy. Empathy is this feeling that she tried to understand, share my experiences and emotions and feelings, even though she obviously wasn't the one going through it. She has probably had this conversation with patients thousands, if not tens of thousands of times in her career, and yet I did not feel like just another item on her checklist for that day. I truly appreciated the warmth, the compassion, the empathy that she gave to me. And I share this partly with this audience because I know that there's a lot of fellow patients in the audience like me. There might be some medical professionals, and this is largely directed to them because this is a big thing I stress when I give the talk to medical audiences. But I think it's also really helpful for caregivers. My wife has heard this talk several times, and I think because of this, I think she has a better sense of how to approach me. Other friends and family members who've heard the talk have felt the same way. And I think this is really, really helpful for anybody who's interacting with someone going through a very difficult dilemma like this. What are some key differences between sympathy and empathy? The cartoons are put over here, and I'll point out some big ones. The first is how we relate to the other person. So the sympathy cartoon on the left shows the person in the red shirt, saying the right words. I'm sorry, that must hurt. But you can feel there's almost a distance, professional, transactional feeling about this relationship. Versus the empathy cartoon on the right, person in the red, really, really internalizing what's going on with the person in the green shirt, feeling what she's feeling, the sadness, the upsetness, the anger, whatever she's going through. They're trying to relate to that person in a deeper, more visceral sense. The second big difference is the initial response that we give to someone. If you're a medical professional, the response you give to patients. If you're a caregiver, family member, friend, the response that we give to our loved ones. And when the initial response, tends to involve problem solving, that tends to be in the more sympathy bucket. So the example that I always give to doctors when I give this talk is, when a patient comes to you and they're having a set of symptoms, and you jump into your doctor mode and say, hey, Mr. Smith, Mr. Sampat, I'm gonna, order an MRI. I'm gonna get an LP. We're gonna get this lumbar puncture, EMG, whatever it is. When that becomes your initial response, you are sort of putting the focus on you instead of the patient. It lumps you more in that sympathy category, that sympathy bucket. Versus an empathy-based response is more reflective. Someone comes to you and they are having whatever emotions they're having. You reflect that back onto them. You validate it. You acknowledge it. Even if you do this only transiently, that makes a huge difference to how the other person feels and receives that interaction. The third big difference is the source of emotion. So I personally believe that, most of us are taught at a young age to be good people, to say the right words when someone is going through a loss, divorce, illness. We're supposed to say, I'm sorry. And that's really important. And that should be done. But I think part of the reason we do that is to satisfy our own internal needs and egos. We want to be good people, and that helps us do that. It also makes us feel, in some ways, a sense of relief that we're not the ones going through this misfortune ourselves. Versus an empathy-based approach has a source of emotion that comes from deeper, comes from the heart. It comes from feeling what the other person is feeling and really trying to relate to them in a way that makes them feel heard. So the source of emotion comes from a deeper source. All right, so how do we exhibit more empathy? How do we actually do this, with some practical tips? And this is really for any medical professional listening. I think, when you're interacting with patients in the clinic, in the hospital, I think these are some tangible ways that you can probably do to change your practice, without really adding more time to your day. Because I know, as a physician, I know time is very valuable and very difficult to come by. So these are ways you can exhibit more empathy without actually adding more time to your day. And the first point is to actively listen without judgment. Actively listen without judgment. So when patients come to your clinic, and they're going through whatever they are going through, try to put your bias aside. We all have biases as humans. Try to put that aside and listen without that judgment. Because if you can do that, even for just a few minutes, that establishes a very a core foundation of empathy between you and the patient. Listen without judgment. The second point is to listen with intention. And this is probably the most high yield point for my fellow healthcare providers listening here. Listen with intention. And that means without distraction. In healthcare, we try to multitask all the time because time is very, very difficult to come by. We try to listen to the patient. We try to write notes down. We try to look up stuff, all these things simultaneously. And, as a physician, I've definitely done this. As a patient, I have recognized and acknowledged when providers do this and when they take some time away to listen with intention. So try for just a few minutes at the very least, face the patient, hands still, not looking at the computer, the tablet, the phone. Listen with intention. That goes a long way towards establishing this empathetic foundation. The third point is to listen with advice or without advice. Listen without advice. And that kind of goes back to that point I was saying earlier. When you jump in with your advice very, very prematurely in the encounter, that takes away the patient's story sharing power. It puts the focus on you as the physician, the healthcare provider, as opposed to the patient. Definitely jump in with your advice when it's appropriate, but give the patient some space. Give the other person some space to share their story before jumping in with your professional advice. And the last point, the fourth point here, is to listen with vulnerability. I think this is really, really helpful and really important because, as a neurologist, I will say that, after the diagnosis of ALS was made, the most important thing that neurologists have done for me, honestly, speaking as a neurologist and as a patient, the most important thing they've done for me has actually been to be vulnerable with me. And when I say that, I mean that neurologists have shared stories with me of other patients, young patients like me, going through what I'm going through. That has helped me feel less isolated and more connected. I had a neurologist share with me that, when he was 41 years old, he had a 6-month-old baby and he was diagnosed with multiple myeloma. And obviously our situations are different, but when he shared that story with me, I felt more connected to him. I felt that he was more human. And I felt that whatever he was saying, he got it in a way because he had gone through some similar tragedy. So if you feel comfortable, please share any stories that you can that'll help you connect with the patient. Be vulnerable with the patient because the patient is being vulnerable whenever they share anything with you. So listen with vulnerability. All right.
I think as healthcare providers in our schooling, those are concepts that are often overlooked. They're kind of learned on the job or wisdom that comes with learning from people like you and from one another over time. I just want to interject at this point that if you have some questions, to please put them in the Q&A on the bottom of your screen, and we will address them at the end. Dr. Sampat, if you could speak more directly into your mic, I think it would come through a little bit more clearly.
Let me see, actually.
Like that. That's great.
Is that is that better? Can you hear me
Yes.
a little better? Okay, yeah, please
Oh,
let me.
perfect.
Okay,
Yes.
please let me know, Marianne. If it's still like that, I can adjust in the middle. You can just, interrupt me. So thank you,
Sounds
Carl, for that comment there. And yeah, again, please let me know if it's still not working out. Okay, so the next theme that I want to share with you is this concept or this theme of loss of personal identity. And of course, I'm going to share with you my experience with ALS. Many people on this call, I'm sure, can relate to this. For my fellow healthcare providers in the audience, I think this is really important because sometimes we forget or we overlook the non-objective, the non-physical components of a disease. And I think this is really, really, really crucial because this actually impacts patients in a way that is very significant. For any caregivers or any friends or family members listening as well, think about this because, at times I think, these things are overlooked because as caregivers, you were quite busy just putting out fires, surviving, trying to figure out how to make it through each day. And I see that, with my mom and my wife who are my caregivers, it's very difficult. But think about these other components that are impacting your loved ones. Because I think if you can do this, I think you're able to share their experience in a way that is beneficial for both of you to establish that connection in a deeper way. So this part of the talk is always a little bit fun for me because I get to share with all of you. I don't know any of you actually, a little bit of who I am as a person. Because right now, all you know about me is that I'm an associate professor and I'm a person who is living with ALS. But of course, there is more to me than just that. I have more parts of my identity than just those two things. The first part of my identity I want to share with you is the part of that I had when I was younger, when I was more athletic and active. I was a runner. I was a track and field runner, a cross country runner. not a very good runner. I was never actually very good at all. This is me with my classmates on high school picture day for track and field. But running became a big part of my identity. And I continued running recreationally in high school, in college, in medical school, and even in residency. This is me with my crazy and equally foolish co-residents at Northwestern because we ran a half marathon in the middle of January in the middle of Chicago. Definitely only something that crazy foolish people would do, and we were a part of that group. So running was a big part of my identity early on. But that wasn't the only thing that I did. I played baseball, I played tennis, and this is me at the tennis venue in Wimbledon, the center court of Wimbledon, a few years ago. So all of these things that you see in the picture are big parts of my early identity, but they are unfortunately things that I cannot do. You guys probably can't appreciate this. I'm sitting in my wheelchair here, but I can't do any of these things. I can't stand up like this even, let alone run a race. I cannot pick up a tennis racket, let alone play tennis. And even though I can still, of course, go to the sporting complex, I have to do it like this, in my wheelchair, sitting, wishing like I was these two girls in the background, as opposed to the person who is sitting down. ALS has taken away in less than 3 years this huge part of my identity that I had for so many years. This disease that I have has changed who I am as a person because of the physical limitations that it has brought on. And I know that many of you can relate to these things as well, which is why I am sharing them with you. So running and sports was only one part of my identity. Another part of my identity is, of course, my professional identity. And this has been very, important to me and very devastating to me because I have lost a big part of who I am as a professional. So I actually started my post-medical school life in the wonderful world of anesthesiology. But I soon realized that my true passions were actually not in anesthesia, but actually in neurology. And this is me now as a neurology resident giving a lecture to some of our junior residents. But then I found the best subspecialty in neurology and in medicine, and that was, of course, sleep medicine. Now, this is me doing a sleep study with my co-fellows to figure out what patients go through when we actually order one of these things in the medical system. So being a doctor, being a sleep clinician, a neurologist, became a huge part of who I am as a person. But as Marianne mentioned early on in the introduction, part of my professional life that I have cherished and loves the most was and is my role as an educator. This is me with our department teaching award a few years ago. I love teaching. I love mentoring. I love advising. I love watching trainees grow and being a part of their development. And this has all been a huge, devastating loss for me as a doctor. Less than 5 years after completing my medical training, I was diagnosed with this, and I was not able to do these things that I trained for over a decade. I can't teach. I can't teach in the clinic. I can't see patients in the hospital, and that has been really difficult for me to try to process. And while I can still do some things, like give a talk like I'm doing right now, or give a lecture in person like this, it's still very, very different, and it's still very, very difficult because I have lost a huge component of my identity. And this is something that you won't see on my physical exam. You won't see in my medical chart. It has affected me more than probably anything else in my journey with ALS. But the most devastating blow for me as a person living with this disease is the loss that I have experienced as a father. So as a young father, young healthy father, I did all the things that young healthy parents do. And that of course involved a lot of this. Diaper changes, anyone with kids or grandkids or nieces or nephews know that this is a big part of early parenthood. But of course, diaper changes is not the only part of what we do as young parents. We do a lot of fun stuff. And I spent every Friday with my daughter for almost 2 years, taking her out to do fun activities, to the park, to the beach, to the zoo, to Costco, to Target. We did all these fun things, and I really cherish these memories because I can't do any of the things that you see in these pictures. I can't change diapers. I certainly can't hold my daughter up, and I definitely cannot sit down and stand back up without significant assistance. And this has been the most difficult part for me in this journey, the changed role, the changed identity that I have in my family. And of course, I'm still very grateful that I have such a wonderful and supportive family. This is my wife, my superwoman wife, that keeps our house afloat despite being a busy physician herself, and my two adorable kids that you can see here. But it's very different being a parent on the sidelines as opposed to an involved, engaged father. And I share all of this with you because, this is a different audience that I'm used to speaking with. Many of you can relate to this. Many of you have experienced similar loss in your own lives with ALS. But I share this for anyone in the audience who is a medical professional, someone who might be working with patients or loved ones going through a loss. Because every patient that you see and interact with has something like this. They don't have the same platform that I'm given, to share my story, but they all have a loss in their identity, with their careers, with their hobbies, with their families. And these things are as devastating, in fact, more devastating in my experience than the physical limitations that come with this progressive physical illness. The loss of identity is something that is very difficult to fix. And it's something that affects us emotionally, psychologically, mentally. And when I was giving this talk for the very first time, I reached out to a support group that I'm in and I said, hey, everybody, I'm giving a talk to neurology residents. What do you want them to know about your experience? And I got, believe it or not, I got over 200 responses from patients and family members. And this is the response that I think really captures the general sentiment of the group. So let me put this up here and then give you about 20 seconds to review it, and then I'll go over it with you. ALS robs us of everything, not just our physical abilities. It changes our relationships, our careers, our hobbies, our homes, our independence, and much more. These things can easily impact our self-worth. Doctors need to understand what neurological disease steals from us in addition to our physical abilities. And I think that's such a powerful quote, a powerful set of words there, because, when I'm giving this talk to physicians, I share that, oftentimes we as busy healthcare providers, we focus on the things that we can see, the abnormal lab values, the lesion on the MRI, the CT scan with something in there. We tend to focus on these things, but oftentimes the parts that affect the patients the most are the ones below the surface. Like I said, the loss of your career, relationships, homes, independence, all these things are things you won't pick up on in your exam or in your workup. But please don't forget them, because they affect patients. If you can even acknowledge this, you're not going to be able to fix this, but if you can acknowledge this, that goes a long way to making the patient feel heard, that you actually want to try to understand what they're going through. So don't forget these components that lie below the surface. All right. So I'm going to continue. I think I'm okay, Marianne. I think I can probably continue.
Okay.
Thank you. All right. So I'm going to move on to the next section, which is this sort of theme of isolation and support. And this is, again, I think a mix relevant to both patients and healthcare providers and caregivers. I think there's parts here that can probably be helpful for everybody. So I think sometimes when we in healthcare, hear the word isolation, we have an image that comes up like this. An older person, maybe sitting in a wheelchair, looking outside of a nursing home by himself or herself. And isolation can definitely look like this, but isolation can look like many things. And it can even look like this: a seemingly healthy young person who is sitting in a cruise ship with a beautiful backdrop of Antarctica there, but feeling internally isolated because he is the only passenger out of 350 people who has to be in a wheelchair. Isolation comes in many forms, and definitely with ALS, it is there because of all the things I mentioned already. So what do we do about this, right? As healthcare providers treating patients, as caregivers, working with patients, what can you do to help them feel less isolated? I think one of the biggest things that we can try to do is to find a support network and resources that help patients feel less alone. And they exist in ALS as they do in many other conditions in medicine. Here's a few of them that I think many of you probably have already explored on your own, but I'll review them with you just in case that they're new to you. The first is this Facebook group, the ALS support group. Many of you are probably in that group. If you're not, I would say it's really a nice forum to get questions answered, to talk to people who are going through something similar. And for me, this group has been really, really helpful because I have met many young people around the country with ALS. And that's important to me because, quite frankly, I don't relate to the normal 38-year-old without this disease anymore. Their problems that they go through are just very different than my challenges. But likewise, I do not relate to the 65-year-old with ALS because, that individual might have kids who are much older than mine. They're in a very different life stage than I'm in. So this group has helped me find people who are like me, and that's helped me feel less isolated. So if you're feeling isolated, please reach out to this group. You might find some friends that you can connect with, maybe even local friends, and that may help you in your own journey. Team Gleason is a wonderful resource, a very patient-centric resource, in my opinion, that helps patients with various things. Get funding for voice banking, get funding for equipment, getting portable wheelchairs, doing bucket list adventures. It's a very, very good organization started by Steve Gleason of the New Orleans Saints, who was diagnosed with ALS about 13 or 14 years ago now. So please check that out if you're looking for resources and help. They are a good support service for that. I Am ALS, you probably heard of this organization. It's been started by Brian Wallach, another young person diagnosed, I think, when he was 36 or 37, with a lot of political background and connections, and they do a lot of advocacy work. They have a great set of resources and things on their website that might be helpful for you if you're new in this diagnostic journey. And Rune is a relatively new player here on the ALS map. They have a lot of videos, a video library that you can access free of charge with answers to many common questions. They interview patients, caregivers, doctors, other healthcare professionals, and it might be helpful for you to check that out, especially again if you're very early on in your diagnostic journey. The next point is really geared towards healthcare providers. And that point is to be receptive, be open-minded to alternative therapies. ALS, as all of us know, is a disease that does not have a cure. We don't have great treatments. There's no definitive, medications that we can give that really do drastic changes, unfortunately. And because of that, I think it's really critical for neurologists, for other healthcare providers to be open-minded. Be receptive to alternative therapies if the patient comes to you and wants to try them. Be honest with them. If you think it's going to medically harm them or financially harm them, that's important for us to know. But it's also important for us to have your support as we try to figure out a way to slow this disease down. And this is a website, a resource that I think really highlights that principle. ALS Untangled, you may have heard of this. This is a website that reviews alternative and off-label treatments with the goal of helping patients and family members make informed decisions. This was started by Dr. Bedlack out of Duke University. It's a nice resource. I've used it myself. And I think it's a way, if you're looking at trying different supplements, vitamins, things that may not be mainstream, check this website out because they might have reviewed it and they might have been able to give you some recommendations. All right, so this last section here, this last slide, is really geared, I think, for my fellow patients. This is a slide that I don't share when I give the talk to medical departments and neurology groups, because I think this is really helpful for us, and I'm putting my patient hat on now. And this theme here, this section here, is to try to find some purpose after diagnosis. So for the first six to 8 months after I was diagnosed, I was in a very, very bad place emotionally and mentally. I was spiraling downwards, and it was not a good thing for anybody interacting with me. And I think, part of that is because all of a sudden, I went from being a healthy parent, a physician who loved my work, to having all of that come down and be gone. And I didn't know what to do, and that was a very difficult thing for me. I had lost my purpose in life. And I was, talking with various friends about this, and of course, trying to make things better. And, one of my best friends from medical school, he's an oncologist. And I talked to him about this, and, he asked me a simple question. He said, Ajay, what is most important to you? And I said, thought about it, and I, gave the answers that a lot of people would give. My family, my work, these are the things that keep me going, that are important to me, and I can't do it. And he said, you can't do what you were doing before, but these things are still important to you, and you can still try to find a way to make that a part of your life. He told me that, with every patient that he sees with cancer, he asks this question: what is most important to you? Because he says that when patients think about this and they try to find a way to get that purpose back after a very serious diagnosis like ALS or cancer, they tend to actually have a better quality of life. They tend to actually, live longer, and they tend to be happier. And so that is the important question that I asked myself: what is important to me? And of course, family comes first. It's the top of that list. My professional work was very important to me. And those are the things that I tried to harness. So I got myself out of that rut that I had for 6 to 8 months. And I gave my very first talk, sharing my journey and a lot of the similar things that I talked about here with our neurology residents. And for me, that was such a positive experience that I did many more talks, mostly on Zoom now, with other departments around the country. For me, that gave me some sense of professional purpose back. And for all of you listening here, I know my experience is very different than yours. We all have different backgrounds and different lives. But try to find a way to see if work is important to you. See if there is a way to still do that. It's going to be a different role, of course. But if you can stay engaged, that may give you some of that purpose and drive to keep going. Family, of course, is also extremely important, probably the most important thing. And so I tried to find a way to stay relevant with my kids and my family. And one of the first things I did, because my symptoms started in my limbs, in my hands, one of the first things I did actually was to write handwritten letters to my kids. I wrote them 4 letters each, that they could open at different milestones of their lives. And for me, that made me feel like I was getting some sense of control back, some sense of purpose back in my family, that I could still be a father, even though I couldn't be the father that I originally envisioned, a few years ago. I was so, I was so energized by that I actually took it a step further, and I wrote this book, sharing stories of my life that my kids can read at some point. It's through a website called Storyworth. I think there's a few different ones out there like that. But again, for anyone out there in the audience that, wants to do something similar, you can do this. You can do this. It gives you a sense of control, and I think it's helpful to to feel like you are still able to do things that you would have done. Video messages was another big part of how I spent my first year after diagnosis. Writing or recording these video messages to my kids. And so if anyone has kids or grandkids and they want to share things, you can do this. You can easily do this with your phone. Doesn't have to be elaborate, but that gives you a way to get some of that purpose back in your family. So I put passions and strengths here because we are all very different. My passions and strengths are different than yours, but harness your passions and strengths when you try to find that renewed sense of purpose. This can mean doing things like, the work that I'm doing, right, or the stuff that I was doing with writing books and letters, or engaging in advocacy work, fundraising work, whatever it is that fills your cup. Please try to do this, because that's going to help you. It's going to help you in your disease. It's going to help you with the quality of life. And the last piece here is about legacy. I've gotten a lot of questions when I get this talk about legacy. What do you think about your legacy, and how do you want to, to carve that out? And it's a difficult question to answer, because our legacy is something that we'll never know until after we're gone. But I think if you can try to use your passions and strengths and create your own legacy, that again gives you a sense of control. And this is the disease, as we all know, where we lose so much control every day. So try to do things that create your own legacy. This is one thing that I did, that actually my colleagues did, that was really important to me. And that was establishing this award for medical students at UC Davis, so they can further explore their career in neurology. And for me, that's important, because teaching is such an important part of my identity. And I really wanted to have some way of still having an impact on medical education. So this was something that was really important for me, not just with purpose, but also legacy. But again, think about your own situation. Think about your own lives. Think about what's important to you. If you can do even small things, that actually is going to go a long way. So really, really think about that question. What is important to you? Okay, some final points here, just to recap. The green is really kind of geared more towards healthcare professionals who are listening, and the red is kind of for my fellow patients and caregivers. So the first point is about empathy, and that is about time. So being empathetic doesn't mean you have to spend more time with someone. It just means you have to take an active, intentional shift in your behavior as a clinician. When I was giving this talk once, I had a great quote that someone shared with me. They said, take your shoes off at the clinic door, and as you walk into your patient's room, step into theirs. That, I think, was very powerful, because it just shows that you have to try to put yourself in someone else's shoes to really understand what they're going through. And if you can do that, you can be empathetic. Learn from and listen to your patients. Each of them has a story. Each of them has an identity that extends far beyond their history and exam they come in with. These things that lie below the surface tend to be the most relevant and the most important to patients, so don't ignore them. For my fellow patients and caregivers, try your best to find the right support network and resources. And this can sometimes come in unexpected places. I have found in my journey that some of my closest friends before have sort of dropped off the map. Either the the seriousness of this is too much. The grief is difficult to navigate for them, and they've sort of just stopped talking. But I've also found that people that I haven't talked to in a while, they have re-engaged with me and consistently, and they actually become much more closer and much more of a support network for me. So try to find that support wherever it is. And of course, the last point that I just talked about in the previous slide is to continue to try to find purpose in your life. Ask yourself that question, what is important to me? And if you can do that, and if you can figure out what's important to you, try to harness that. Try to do things that um, fill that importance, because that is going to keep you going, and that's going to help get through each day. All right, I think that's it. Thank you so much for listening, for the invitation, for the engagement, and I think we should have a few minutes for questions, right, Marianne?
Yes, indeed. If I were to say one word, I would say, wow. Wow, thank you so much. There are a couple questions and a couple comments.
Okay.
The first one is, thank you. I so relate to your story. I am also a physician. The second comment says, having an empathic doctor is so important. My husband was in a clinical trial and absolutely loved the team. He looked forward to all of his appointments. The doctor was kind and had a sense of humor and always listened. He told my husband he should make decisions that he was comfortable with. When the trial was over, he told us to reach out anytime we wanted to. He and his team made such a difference, and we are so thankful.
Absolutely. No, I think it makes a huge difference having a team like that. So thank you for sharing that comment.
Yeah. Another comment, thank you. An excellent presentation on capturing the challenges and journeys of a person with ALS.
Thank you.
And one question says, I am 3 months into this and I wonder how you stay positive. What is your way of staying that way?
It's a really good question, and I wish I had a great answer for you. Some days are easier than others. Some days are just hard. You know, it's just hard to stay positive some days. But what I found actually that's helped me is, trying to associate with people and things that give me that positivity. And that's being very selective. With people that I interact with types of things that I do. If it's not filling my cup, I have just stopped doing it, because I feel like time is obviously very valuable to all of us, especially living with this disease. And if you sort of spend time on things that are not filling your cup and making you happier, that's actually detrimental. So again, with people, find the people that keep you positive, find the things that keep you positive, and that's going to hopefully give you more better days than worse days.
Valuable advice. Another question, I don't know if you're comfortable answering. Do you have any recommendations for effective alternative therapies?
I'm on a few things that, again, I don't know actually if this is helpful or not. But supplements and vitamins, I think people try different things just to see what happens with them. I'm taking, there's a product called Lcium Basis. I think Dr. Bedlack reviewed that, and he actually probably I think he or someone else made some positive suggestions of that. So I'm taking that. I'm taking vitamin D. I was taking vitamin B12 injections. I'm on an investigational component or a therapy that may help slow down breathing decline. Those are kind of the big things. What I've heard from other people, actually, if you're in terms of non-medication alternative therapies, I have several friends actually that swear by this. They swear by doing Pilates. Pilates because they feel like it actually helps their core strength and their breathing. And I did this actually for several months early on. It became harder, obviously, when I couldn't drive myself and do the things. But things like that might be helpful. Water therapy, so going in the pool and just movement with those in the water actually helps a lot. So that's one thing if you have the access to that, to do that. And I think, I think things like stretching are probably just not done enough. And I'm guilty of that as well. So I think if you can do things like that, I think that actually might help with some of the symptom relief.
Thank you. And what is the exact name of the Facebook support group that you mentioned?
Yeah, there's a few out there. The biggest one I believe is called just ALS support group. So if you search for that, it's a private group. You have to, not apply, but you have to request to be in it. They're going to approve it more likely than not, and you will just have access to basically a lot of people in the country with this. There's a group out there. It's called ALS Young Person Support Group, and it's for people who are under the age of, I believe, 40 or 50 when they were diagnosed. It's a much smaller group, so I feel like the ALS support group is the biggest one for most people to do.
Great. That is it for the questions that we have. So once again, thank you so much, Dr. Sampat. To say that your talk was valuable is an understatement. There's advice that we get from our physicians and our team, and then there are insights that we share with our peers. But you provided, a very unique and powerful perspective as both a physician and fellow human being walking in our shoes. And that's that thought I had before you even talked about leaving your shoes at the door. But thank you so much for sharing your experience, your time, your advice, and everything. And we thank you and we wish you more than the best.
Thank you. I appreciated all the comments and I appreciate the invitation. So thank you for inviting me and thank you for listening to my story.
Oh, perfect. So this actually concludes our summit, our 2024 Education and Resource Summit. It was 2 days full of powerful sessions. There were 14 sessions and more than 250 attendees. The sessions have been recorded and they will be made viewable next week, both on whova.com, our ALS United Greater New York website and YouTube channel. We'll send out a notification when the recorded sessions are available for viewing. We'd like to thank our sponsor, Mitsubishi Tanabe Pharma America, for helping to make this possible. And lastly, we hope that you can join us at some of our upcoming events. Walk ALS in Westchester, New York on June 1st. Walk ALS in North Jersey on June 9th. Additional Walk ALS events this fall at the Jersey Shore, Long Island, and Hudson Valley. Lou Gehrig Day with the New York Mets at Citi Field on Sunday, June 2nd. And please visit our website, als-ny.org, for more information on these events and other patient and caregiver support. And learning and sharing doesn't end here. Our website also outlines what's going on, our monthly support groups, our Talk, Learn, and Connect series, which goes on all year long. So thank you so much.